Make sure to like and subscribe and hit the notification bell to receive helpful tips on how to relieve pain. If you have any questions, put it in the comment section down below. Hello everyone, welcome. This is Dr. Jacobs. In this video, I'm gonna go over how to treat or fix cervical radiculopathy, the 3 powerful treatments that naturally treat and address the root cause of cervical radiculopathy that majority of healthcare providers overlook. That's why a lot of people do not get relief or do not have the treatment, the proper treatment that treat the root cause of the issue. Before going over the treatment, we need to understand the normal healing cycle so it will make sense how to treat the root cause of the problem. So I'm gonna use external paper cut for visualization, but the same process happens internally when you have cervical radiculopathy. So the first stage of healing is inflammation, swelling, redness, and the blood start to rush to that area. Second stage of healing, it's called the proliferation stage. During this stage, you actually start to have scarring or fibrotic tissue, fascial restrictions, and muscle spasm. And actually, if our body does not build the scar tissue, it's open wound susceptible for infection. So scar tissue very essential for our survivals. We need that. The problem is if you have too much of fibrotic tissue, you're gonna compress on the nerve and cause cervical radiculopathy. This image is for the lumbar spine, but I like that image because it can visualize when you have herniated disc or something compressing on the nerve, but this is a lumbar spine, the cervical spine, all the way up in the top. So when we look at the cervical spine, in this area you have the skull. So you have the nerve coming down. When you start to have inflammation or scarring or fibrotic tissue, that compressing on the nerve will start to have the cervical radiculopathy symptoms, numbness, tingling, and weaknesses in the upper extremity. So in the normal healing cycle, our body resolves everything during the maturation stage, and that clears up everything from the inflammation that compressing on the nerve to the fibrotic tissue, the fascial restrictions, and everything clears up. When you continuously have symptoms, you're not in the normal healing cycle. You are in a chronic cycle, which is actually your body going back and forth between inflammation and proliferation stage that's compressing on the cervical spine and causing numbness, tingling, weaknesses in the upper extremity. So to treat the root cause of the problem, we have to address the normal healing cycle. But before I go over the proper treatment, we're going to go over the treatment that currently used by a lot of healthcare providers, but it's not effective. I will relate that to the normal healing cycle so it will make sense why you should not waste your time and money on something that's not really addressing the root cause of the problem. So effective treatment, and I will have a link underneath this video for the study that shows this treatment is not very effective. So looking at normal, like common treatments, heat and stim or ice, when we look at the normal healing cycle or the chronic condition, ice temporary would decrease inflammation, but it's not going to be effective to break adhesion, fascial restriction, or addressing the inflammation properly. Stim is the same thing, it's temporary pain relief, but unfortunately a lot of studies show this treatment does not provide long-term result. And when we look at the healing cycle, it makes a lot of sense why these not effective treatments. Foam roller and massage, and when you look at the healing cycle, when you have open wound and inflamed area and you keep rubbing it, it's gonna inflame it more. So it's gonna cause more inflammation, but foam roller and massage is not targeting the proliferation stage to target the fibrotic tissue, fascial restriction, muscle spasm, so it's not gonna provide a long-term result. The same thing, acupuncture and dry needle. When they put a needle around superficial area, it's not going to decrease inflammation. It's not going to cause mechanical force to affect the proliferation stage. The other common treatment that's used by a lot of healthcare providers, joint mobilization, moving the joint. But when we look at the healing cycle here, that movement in the joint is not going to break the fibrotic tissue and the fascial restriction, because most of these are around the soft tissue, and too much mobilization could cause more inflammation. The other thing that's commonly used is stretching, and I personally do not use it because the studies show the stretching is actually cause more inflammation. Strengthening exercises is applicable if you're not having inflammation, but it's also not going to decrease the inflammation. But actually, if you introduce strengthening exercises in acute stage, it will cause more inflammation, but it's not going to do anything to break the vicious cycle of inflammation and proliferation. So how to treat the root cause of cervical radiculopathy? We have to break that vicious cycle. So to do that, the first thing I do is addressing the inflammation. So if you are in acute stage, rest should be good enough for a couple of weeks, and resting that's mean don't lift anything, have proper posture, and if your symptoms have been resolved, that good sign that it's a minor inflammation. If your symptoms has not been affected at all or getting worse or has not been resolved, you have a chronic condition that we have to be aggressively decreasing the inflammation and breaking the inflammation proliferation vicious cycle. So what I personally do is I give my patient MagnaHeal 2. This is very strong magnet, the magnetic field around 3 to 4 inches, that they wear it in the neck area to decrease localized inflammation. I notice with those patients that they have a lot of vitamins and mineral deficiency that inhibit their body from going from inflammation to proliferation to maturation stage, because, for example, you need vitamin D, magnesium, C, B, and other vitamins and minerals for the body, for your body to transition from inflammation to proliferation to maturation stage. And when you have deficiency, your body gonna stuck in this vicious cycle. And that's one of the things extremely overlooked by a lot of healthcare providers. They don't look at your nutrition and vitamins and minerals to see which vitamins and minerals inhibit your body or prevent your body from healing. So that's extremely important part of the treatment, restoring deficiency in the body. At the same time, I like to put my patients on anti-inflammatory diet, because there's certain food that cause internal inflammation in the body that will interfere with the normal healing. So to really address inflammation properly, I'd like to use the MagnaHeal to decrease localized inflammation, start on anti-inflammatory diet, and do proper evaluation for vitamins, minerals, and hormonal imbalance to make sure internally the body in a good state for healing. So to address the proper problem, we have to break that vicious cycle by addressing the inflammation. The second treatment that extremely overlooked is the proliferation stage, the fibrotic tissue, and the proliferation stage. So when you have internal damage due to herniated disc or osteoarthritis or any degeneration around this area, going to push on the nerve here, and that fibrotic tissue will cause the cervical radiculopathy. So when we look here in this image, you will see the muscle nice and smooth like the first image here. When you start to have a tear in the muscle or a tissue, it's going to look like this. When your body built fibrotic tissue, it actually built it randomly like this. So when you have fibrotic tissue that's compressing or close to the nerve, that could cause cervical radiculopathy. Remember, we don't have a lot of room here for fibrotic tissue or inflammation. Just 1 to 2 millimeters of excessive pressure on the nerve will cause the radiculopathy. So as you see here, this is a normal vertebra and have normal healthy disc. But when you have fibrotic tissue or inflammation, those unevenness will compress on the nerve and could cause the radiculopathy. So doesn't matter if it's a herniated disc, if it's osteoarthritis or other tissue that cause the inflammation or the fibrotic tissue. What matter is the inflammation and the fibrotic tissue need to go down. So we need to decrease that. If we can decrease it by 1 to 2 millimeters, that could resolve the symptoms. So what I personally do to decrease fibrotic tissue is using the A3 to decrease external fibrotic tissue, and I use the A5 to break down deep fibrotic tissue. At the same time, while we're working on inflammation and fibrotic tissue, the third effective treatment that has to be done simultaneously is releasing the fascia restriction. And I will explain briefly why fascia is extremely important and extremely overlooked by a lot of healthcare providers. So next time when you go buy meat, look at the white filament. That white filament, that's the fascia layers. To make things complicated, but don't worry, the treatment very simple. The fascial layers comprised of two major categories: superficial layers and deep layers. And the deep layer divided to four subcategories: apoptotic fascia, epimysin, premiysin, and endomysin. Make it more complicated, each of these layers divided to 2 to 3 layers on the top of each other. And when we look at the cadaver, you can see here the white filament, that is a that is the fascia layers. So when you have fascia restriction, it's like you're wearing a Spider-Man suit that's 2 to 3 sizes too small. It can prevent the range of motion. And if it's in your neck, it compress on the tissue underneath it and could compress on your nerve. So it's extremely important while we're releasing the fibrotic tissue, we have to address the fascia layers. And we cannot pick and choose to work on a superficial layer and apoptotic layer and ignoring the deep epimysin, premiysin, and endomysin that's closer to the tissue that actually could compress on the nerve. So what I personally do is I use the A1 to release superficial and apoptotic fascia layer, and I use the A5 to release the epimysin, premiysin, and endomysin in order to treat the root cause of cervical radiculopathy. We have to simultaneously decreasing the inflammation, releasing the fibrotic tissue, and the fascia restrictions. And as I mentioned, if we decrease the pressure on the nerve by 1 to 2 millimeters of inflammation or fibrotic tissue, that could resolve the symptoms. We all have herniated disc. We all have arthritic changes. The problem is when you have excessive herniated disc or arthritic changes that compress on the nerve, just 1 to 2 millimeters that compressing on the nerve, you will experience the numbness, the tingling, the weaknesses. So the goal is to decrease that, but by decreasing the root cause of the problem, which is inflammation, fibrotic tissue, and fascia restriction, in order to resolve the symptoms. If you have any question or comment, leave it in the comment section below. I will answer it in a future video. See you soon. Make sure to like and subscribe and hit the notification bell to receive helpful tips on how to relieve pain. If you have any questions, put it in the comment section down below or go to asterinstitute.com.